Is it safe to fly overseas at 30 weeks of pregnancy?
Flight will be the best option for a long distance and overseas travels. Make sure the seat belt is in between the breast and the lower belt will come below the belly.
Which month is unsafe to travel during pregnancy? Whether you are planning a relaxing baby moon or having an important travel coming up, we will cover everything you need to ensure about a safe and comfortable journey. Welcome to today's episode where we will be discussing an important yet exciting topic, traveling while pregnant. Joining us today Dr. Pooja Bansal, an obstetrician and gynecologist at Cloud9 Hospital, Nerul, Navi Mumbai. So let's get started. Welcome Dr. Pooja.
Thank you so much for having me here.
So doctor, what are the best transportation modes for pregnant women?
Modes of transport for a pregnant woman, depending on how long is the journey and what are the gestational age we are traveling at. So, if you consider the road transport, this is okay to travel for a short to medium distances, okay, because it may cause a lot of discomfort for sitting for a very long time. Considering the train travel, that's very safe for a long distance, and especially if you are in the second and third trimester. Flight will be the best option for a long distance and overseas travels where we probably have a long journey to cover up.
Okay. Is it safe to fly overseas at 30 weeks of pregnancy?
Generally, at 30 weeks, we are in third trimester. So that time, considering the risk of preterm, that means the early delivery, or considering the risk of that we may have, complications like swelling in the legs or DVT. Those are the very commonly seen complication associated with the long distance travel. Otherwise, it is okay and safe to travel 30 weeks overseas if your doctor has given the clean chit to you. That means you are safe medically to travel.
Okay, so doctor, the most important question, how can someone stay comfortable during long flights or car rides?
Okay, so first of all, you're pregnant, that you need to remember, okay? So the second thing will be that we carry our essentials, right? So if we are going for a long distance travel, be it as a flight or a train, you should have comfortable clothing, you should have comfortable shoes. Carry your snacks, carry your water bottles, carry your medicines which probably you're taking routinely, or the medicines which you may need on a SS basis, like if you have vomiting or fever or XYZ body pain. Especially to avoid complications while traveling, we try to take small gaps in travel. So if you are traveling by road, maybe hourly you can take a break and then go. So if it's a long ride, take a break and go. If you're traveling by flight, every hourly you'll walk around, okay, and take a round, use washroom, drink good amount of water and hydrate yourself well. Make sure that you're not skipping meals, okay? So the meal timings should be as accordingly. You should be provided food on time. There are something called as compression stockings, okay? So these are to prevent the deep venous thrombosis there, where we are sitting as a pregnant woman, considering she's in third trimester, and she's sitting for a very long time. So there the possibility of circulation in the deeper veins or the lower limbs can be hampered. So these stockings help you to maintain the circulation. You do not get a lot of issues related to that. Edema will be prevented, okay? To avoid this, the other option is always that we start giving little bit exercises, like you're doing the little bit stretching movements of your legs, hands, upper body, so you don't hamper the circulation. You're moving around in some time, or if you're by road, taking a stoppage and taking a walk will be a good option. You're wearing seat belt, be it is via flight or via road travel. Make sure the seat belt is in between the breast and the lower belt will come below the belly. It should not be over the belly, because that will be very discomforting to you. So that's one more thing to be addressed. So most importantly, washroom accessibility should be there, because pregnant ladies need to go very often to the washroom. So that's also one of the things that you keep in mind. If you have gleaned it from your doctor that everything is safe to travel, I think these are the basic that we take care.
Doctor, is it safe to ride bike or scooters during pregnancy?
Okay, if you're a good rider, yes, it is. Okay, but if generally girls who ride bike, the first trimester will be comfortable to them. Okay, because this time the tummy is not there, so most of the time, if they're confident driving, they can drive. So as the second trimester onwards, or a mid second trimester onwards, the tummy starts to appear, and your center of the gravity starts to fluctuate, and it will change. So the possibility of you not maintaining the balance over the bike is very high. So chances of your getting, disbalance is also very high. So somewhere second trimester onwards, I say to avoid bike rides.
Okay, that's important. So, doctor, what should an expectant mom pack in a travel bag during pregnancy?
What to carry in the bag or the travel bag would be, first of all, that your medical records. Okay, so whatever ANC medical records you have, that you should carry with you. All the medicines what you're taking, emergency medicine would probably as well basis where you'll be needing it. Good amount of cushions, definitely. Good relaxed clothes, shoes which are more relaxed, snacks, your water bottles. Definitely, you may need certain SOS things according to your pregnancy. So you may ask your doctor that what extra should I be carrying. A certificate, a list of hospitals where you can visit where you're going. Okay, so you should always have a backup plan. So it's like if I'm going there, the possibility of if there's an emergency, where should I be going and what should be my next step, right? So these all things to be carried, with your mindset that okay, I'm traveling for a long distance and I will be safe at any possible time.
So, doctor, how can an expectant mom ensure proper hydration and nutrition while traveling during pregnancy?
As I spoke, the hydration and nutrition while traveling pregnancy, that you carry your most of the requirement needs. Okay, so you carry the water bottle. Come with the minimum to minimum that at least 2 to 3 liter of water should be consumed within a day by a pregnant woman. The plain water. Beside that, you can have electrolytes. You can have ORS. You can have coconut water or infused water. So okay, so these are which will give you energy. Okay, which will not make you feel dull because of the travel exertion. Very small gap between the snacks, continuous munching, will also keep the energy level high. You'll not feel most of the time, weak or low or, hypoglycemic. Okay, so carrying your own dry fruit, probably a little snacks, protein bars, all these should be the one essential thing. Most of the time, the pregnant women while traveling by any of the transport will be the motion sickness, or you may get a lot of nausea, vomiting. I always say that if you have nausea, vomiting, still make sure that after you had a vomiting episode, after some time, you try to consume something. At least your energy levels are not going down. Okay, so that way we can definitely maintain the timings of the food. Of course, if you flight or if you train, whatever is the timing, you don't skip meals. Okay, so that's the one primary thing, that while pregnant you should not be skipping meals.
That's very informative. Lastly, which month is unsafe to travel during pregnancy?
Month which is unsafe to travel is again the first trimester and the late second trimester, where the possibility that we may have spotting, bleeding, or may have the possibility of preterm labor is considered to be very unsafe.
Thank you so much, Dr. Pooja, for sharing your valuable insights and expertise on such an important topic. It was an absolute pleasure having you here.
Thank you so much. Thank you.
We hope you found this discussion very helpful and informative. If yes, please do share it with others and subscribe to our channel for more such informative episodes. Until then, take care and stay healthy.